Good morning. Good morning,
Morning.
everyone. Welcome to Hang Out at Dome with Howell again. So today I have such beautiful women with me, and we are going to talk about a very, very important topic. So please listen. Anyway, on my far right we have Linora, who is she just said personal coach, radio host, MC, YouTuber. Did I miss anything? I think I didn't miss anything, right?
I don't think so.
Okay, I think I covered everything. Oh, one more.
Bikini athlete.
Bikini athlete. See?
Banyak.
Banyak. Okay.
That's it.
And then I have Puveshini, who is our clinical psychologist from Rekindle Therapy.
Yeah.
And this one I have to read from here. And then we have Dr. Yukin Ho. Dr. Yukin Ho is Associate Professor at University of Nottingham, Malaysia. She is also a collaborating scientist for Cancer Research Malaysia. And also
Spot on.
L'Oreal's Women in Science Rising Talent 2018. So, strong women today. Physically and literally strong. Yeah. So we're gonna just start off the topic because I think when I bring this up amongst friends or other women colleagues, it is such. I just love watching their reaction because everyone gives me a giggle, like a really nervous giggle, because they know that why are women so scared to go for checkups? Why? Why is it that women are so scared to go for checkups? Anyone wants to jump in and start?
I think it's natural that people are scared, like of the fear of the unknown. Like, what am I going to find out? And if I find that out, is that going to be something I can live with? How am I going to change my whole lifestyle around that? All that fear of change. The fear of the unknown and the fear of change can be a strong deterrent.
Yeah, but then we also hear people say like, oh, it's better to find out early, right?
Yeah.
So, how does that work? I mean, Linora, do you have any experience like dealing with either friends or colleagues
I would say
or
it's,
your personal experience?
Let me see. I think it's a case of denial.
Okay.
Ladies, we like to be in denial
Yeah.
sometimes, and like you said, it's being scared. Just sharing on my side. For me, when this is sharing, I've shared before actually that I've got PCOS. I had PCOS,
Yes.
right? And when I was going through that, basically, you know, when girls, okay, this is completely like a menstrual
It's okay.
educational thing, and it's good to talk about it
Of
because
course. Why do we have to hide our issues?
no, we shouldn't.
Yeah, we shouldn't.
Because
We
it
should
be
just
talked
openly
about.
talk
And
about
that
it.
is actually one of the reasons why I never knew about PCOS, which is polycystic ovarian syndrome. And I'm glad that now more girls are aware because it's unfortunately on the rise. So when I went first, because I was spotting in between and stuff like that, and I figured, oh my gosh, what's wrong with me? And then when I went, the doctor nicely, I wasn't scared because I knew there's something wrong with my body. I think it's a mindset too. If you know what's wrong with your body, you can kind of fix it. And when I went there, doc said, "Oh my dear, you got PCOS." I'm like, "What is that?" And
How old were you? Just curious, how old were you? Because you were
2 years back.
so you know
It's not
2 years.
that
Yeah, so 2 years back, and still you were not
Yeah, and-
aware.
And just
Yeah.
saying, I just turned 34 like
Yeah.
yesterday.
Happy birthday!
Thank you. So you see like how at the age already, it's past 30.
Yeah.
And I don't think any woman or any guy for that matter should ever be scared to do a checkup. If you feel something is wrong, you should go and seek medical attention. Unless you know already that it's something that has been self-caused.
Okay.
I think when we start thinking about what if, you know, you might have the ache here and there,
Yeah.
you're feeling pain here and there. It might get worse over the month, and then you will start to think, you know, if I go for a checkup, what if I found out something is wrong? I think it's very important for us to actually know that doctor is by our side. Going for a checkup meaning that you have a better control in your health.
Right.
Yeah.
So you can slowly solve the what if rather than just dwelling on the what
and
if,
don't
right?
be Dr. Google.
Ah.
As soon as you start Googling, yes,
Dr. Google.
that.
I'm a bad culprit of Dr. Google also. But no, usually I do Google after I find out certain things. Then I want to know more about the topic, so I do Dr. Google the rest of the things, you know.
But you cannot diagnose yourself.
Yes.
With Dr. Google.
Don't
No,
diagnose
A lot of
yourself.
people do that.
You get into a paranoia state.
Yeah.
I actually wanted to do a topic on that on my radio show, Live, Love, Live, and it was I wanted to do a research on like what were the most Googled health diseases online. There are a bunch, but basically it's very interesting that a number of people do it overseas at the States. I don't know about here in Malaysia, but recently
But you have to then Google in Malay if you want to do in Malaysia.
so that's why I
The
couldn't find
statistics,
stats.
you know,
Yeah.
because it would be majority of Malaysians speak Malay, so they probably will Google in Malay.
Worldwide, though, they were saying that the number one that was Googled for was diabetes.
Oh, okay.
So very interesting.
I know a lot of clients who come to me and say that, oh, I have anxiety, I have OCD.
Okay.
And I'm like, how do you know that? I googled my symptoms. But most of the time it's something else. Like when we start talking, we go back to their childhood and we understand the root problem. It's not even what they thought it was.
Right.
But they just stack it one above another. Like I have OCD, I have anxiety, I have depression, I have all the mental illness in the world because Google told me so.
So okay, now that you brought that up, this wasn't even in my list of questions, but now that you said it, we always talk about going for a checkup on a medical perspective, like a physical thing, because you show physical symptoms and things like that. But what if it's a mental thing? You know, should women go for checkups on mental issues? I think that's another thing that, you know, people put aside, because if you don't break down or you're not crying for 30 days in a row or something, then you feel like, hey, what's the point? And then suddenly you snap and then you stab someone lah. But that's just this morning's news. I just read this morning's news about a wife who stabbed her husband to death in Langkawi. So, you know, maybe if she went for some sort of checkup, whether like a mental checkup or a mind checkup or something, probably she might have been able to treat whatever she was having like underlying, right?
Just for some context, what happened? Because I didn't get to.
Oh no. I think it was a British couple in an argument in their house. And it was in the kitchen. The wife got upset and picked up the knife and stabbed the husband to
She just
death.
snapped and lost it.
Yeah.
Wow.
So I mean, you know, that's another thing why when I want to talk here, it's not just the physical aspect. Yes, physical, you know, but also the mind aspect.
Of course, it's
because
wellness all over,
because women forget that, you know, mind wellness also is such an important thing, because when we talk about physical wellness, we talk about, yes, one thing why I find this topic also very important is that women usually are the nurturers of the household. If you're not taking care of yourself, how are you going to take care of the rest of the family? Right? So how can we encourage like women to break away from this notion of having that fear and
I think that's because of stereotype from before. Even just talking about periods or anything to do with our womb has always been, say, taboo, and you don't talk about it unless you talk about it among friends. I feel that it's coming out a lot more now because women were very vocal, and you'd be surprised, right? Because I use this menstrual app called Glow. I don't know if you guys have heard of it. Yeah, and there's actually a forum there for people to just talk and ask on any kind of questions. So I don't know. For me, I think now with the internet, it has broken that barrier of people wanting to actually speak and going out to search for help when they're having some kind of symptom. But maybe verbally speaking out with others, maybe they're still scared too.
Like
I'm
I
not
was
too sure.
telling Eena earlier about these topics, right? Things to do with our womb, vaginal checkup. And all. There's a lot of stigma involved as well. Like we say pap smear, you do it when you're sexually active. But when you go to a doctor, they always assume that you're not sexually active if you're not married.
Yeah, I think that is also the problem. Because let's get real now, okay? I mean, if all the other condom brands out there can go ahead and be telling you to be safe and whatnot, and the amount of media that's actually showing you how to be sexually active, of course, it's going to happen. So I don't think females should actually get scared about it. If they Like another example. Actually, it's a very good example. So this young girl, friend of a friend, okay, she's in uni, and she found out that she had something at her vagina area. So what happened was she was scared to go and see a doctor because one, she's young, and two, she didn't want to tell anyone because who do you go to when you want to go see a doctor at that as a teenager? Your parents. So she was scared, one of her mom. That not so bad, but then after that, my friend was calling me to say, Linora, what should she do? I was like, she needs to go talk to her mom, because I mean that's first place.
Yeah.
Even if you go to a doctor, they're still gonna ask them to say, no, she's not a minor, but still you need someone there, because if not, you're gonna be walking through it alone. So I think it's also important for parents to also speak with their young ones. Like, look, if there's anything you feel is wrong with your body or something mentally, talk about it. I think communication is key when it comes to anything you feel is not right. Like, when I'm pretty open with my mom. I'm like, Ma, I think I'm depressed. And then she'll go like, all right, let's sit down. So she's like, she'll be like, I could have been a therapist in another life. But yeah.
Tell your mom she still can be, okay? There's always time. But that, having said that, right, like Puveshini was saying, so this prejudgy sort of character, you are prejudging someone just because she went in and requested a pap smear. If she was not married, the doctor might say, but why, So doctors, please,
Don't judge.
no judging, People may have a life of their own and, just chill lah. Solve the issue for them. Solve the issue, okay? Not just like...
Scared, like
Yeah, because then you want them to come back and keep healthy. I think another thing that I was thinking is like, what would actually drive women to make that change? What would drive them to make that change in their habit when it comes to health? Have you noticed that? You do personal coaching. When women come to you, what is that drive, do you think?
At this point now, okay, I've got two clients. Actually, no, all of them are very different. First off, of course, is always the physical attribute. But then also one of them came to me because she also had PCOS. She wanted to see how she can go around it. Because PCOS, like the training and even basically is the lifestyle that has to change. So for me, I always say it's always here first. If you can figure out what you want for yourself, then it will become clearer for you to want to make those changes. Then only they'll start asking. But it always has to start first with like, okay, I want to change, I want to improve somewhere, I want to get healthier or better. And then the questions will start coming. Same like for me, that's when I was like, okay, I got to do something. I don't know what exactly, but I'll start asking questions.
Yes.
Yeah. Can I add on that is we have to recognize that change is not an event but a progress. It's a process.
Exactly.
It's a process. When you start asking, you realize that maybe I need to, be active, exercise more, eat more healthily. But once you start, you may stop. I mean, sometimes we go to the gym.
Yeah, I know.
Yeah.
I know.
So
Once you start, you will stop. Yes,
you will
yes.
stop. But as soon as you start, meaning that you're committed to change something. Even though if you stop, you will actually come back again.
Yeah, I think that's the thing. For me, I may start something and I'll stop it, and I'll start and stop it. But I try not to
It's a
beat
repeat
myself up
process.
lah.
Yeah. Yes.
When I
Never
stop,
beat
I don't beat myself up anymore. I used to when I was younger. And then all this fabulous 40 thing, So then I realized that, hey, why do I want to beat myself up? Because I've actually tried.
Yeah.
And I can try again. So you just keep going.
I think like they said, it starts with a change in mindset and you have a certain goal for yourself.
Yeah, but what makes women get to that point where they change the mindset? I'm very curious. Awareness?
I would say it comes down to your why. Why do you want it?
Why am I
tell
doing
all my clients also, I ask them first, why, if everything you do has a reason and a purpose for it. So what is your why? Why do you want to get fit? Why do you want to get healthy? Now as I look more about it, I always say that my why is because of my family. If my parents are getting older, and thank God that I don't have to give full support like some people. But in the end, what is your why? I give another example. A friend of mine, he started getting fit and healthy because he found out that when his wife got pregnant, great, they got a kid, he's now a dad. And then he noticed he can't keep up with the child.
Yeah.
So that's when he started doing, getting more physically active, starting CrossFit, and then that's where he looks fantastic, by the way. Razlan, I got you. And yeah, so it's really down to your why.
And when you have your why, then you can start asking, how am I going to do this?
Yes.
What kind of support do I need? Because for women, it's not only about finding the time for yourself, because you have so many other things to
Of
do.
course.
And you need that support around you,
Yeah.
because you can't just say, okay, kids, just be on your own, I'm going off to the gym.
Yeah.
You need to plan that. And it will be so much more helpful for women to make these changes if the people around them are helpful as well.
Yeah.
Yeah.
I think enough of women trying to be strong and say it's okay, I can do it.
Yeah.
It's okay, I can do it. Because I think I learned the hard way
Yeah.
to actually be okay to ask for help, because I always felt like I'm such an independent person, I know what to do, I know how to solve this, I know how to solve that, so then I forget to ask for help.
Yeah.
Right? And I think women, ask for help when you need it, okay? That's a big lesson I learned.
Yeah.
Big lesson I learned. I think somebody just told me that we have to speak up a bit. My voice is naturally very loud. So that's why I can lean back, because my voice is so loud. But please just, sorry ladies, speak up a bit.
Sure.
Ask for help.
Ask for help, right? And even if you're scared to go for a checkup, bawa your gang with you. Just go. Make it a girl's day out, man, to go for a checkup. I think.
have a friend who's afraid of needles, so every time once I followed her, she was literally on me. And I was there.
Friend.
It's gonna be
Okay, we shall.
That's okay, she's not the only one. I got one friend, okay, poor thing, alright. So cute. She was so scared. She bit her finger and then she was, no, I don't want it. She was crying. I was like, I don't know where to laugh or to pity you, but
But you're just there, right?
Yeah,
You're just there,
yeah. The physical, mental support is good for any female, actually for anyone. Support is always crucial.
Yeah.
But that's such a good idea. Like, make it a girls' day out. We're all getting checkup today. We're all going together.
Yeah.
Yeah.
We're
I
hanging out
think
at the
that
hospital.
really will make the environment
Yeah.
less scary,
Yeah.
because you've got the sort of girl gang that you have, and everyone's there for each other, so no matter what, I mean, at the end of the day, whatever results, the first thing you're going to do is not tell your husband lah. Sorry guys. You're going to tell your girlfriends. For sure. Right?
That's kind of what it is at
Either you tell your mom or you tell your best friend.
Yeah.
But the husband is always like, he will get there lah. You'll get there to telling him, but first thing is either that.
Yeah.
So I've noticed that as well. One thing that Dr. Yuki is doing research is to be able to sort of prevent breast cancer. No, not prevent,
not
but
preventing.
collecting data. Maybe you can explain it better than I.
So what we are trying to do is really to read the genome, the DNA of women, and we have a group of cancer patients and a group of healthy women. We're trying to compare. So what is the story behind this? I think breast cancer itself is actually a story. It's a whole package that you have to understand it before you can try to attempt to either cure it or prevent it. So the problem in Malaysia is unlike the state or in the UK where they have population-based mammographic screening, so where women go for a yearly checkup or do it every 2 years. So the uptake is really low in Malaysia, and then women with breast cancer are usually diagnosed at late stage.
Meaning the ladies don't go.
They don't go for screening, where it's recommended to go from age of 40. So for every 1 to 2 years, everyone to 2 years for the screening. So because the uptake is low, that means that when it comes to diagnosis, it will be a late stage diagnosis. But we all know that breast cancer is a curable disease when it's detected early. So it's really important. So our work is really trying to read our genetic. Can our genetic tell us like who is at a higher risk of getting the disease? And hence, like hoping that knowing your own risk would help to motivate you to stick to the screening program. So I think it's the same as all the other medical checkup. For example, Pap smear. When I was living in the UK, every year or every 2 years, you're gonna get a letter, and they say like, is your time to? It's a reminder. It's time to go for a Pap smear test. But we don't get it here. You have to initiate
Health
that.
ministry, that'd be great to implement.
Yes.
No, that's great.
I know, right? No, when she told me about that,
Go for a Pap smear.
when she told me that, I'm like, oh my god, we should so have it.
Yeah.
You know, I mean, not just go for Pap smear. Here's all the hospitals that have it, or here's all the hospitals that has the promo this month.
But we have to recognize that it's not an easy system with our limited resources. I think what we can do as a women is put it in your calendar. Every
Or
month
remind
during my
each other.
birthday.
I mean, like, it's just saying, hospitals, you got so many people there. You've got data.
Yeah.
So why can't they do a simple reminder? Like, it's just an email blast, for example.
So note to hospitals also.
No, I'm just saying.
No.
Yeah,
But I
Why
think
not?
sometimes it really is just getting that one person to figure it out and put it out there.
Yeah.
So we've hinted many things to all the people out there.
Actually, now that you mentioned it, I'm going to tell it to my female gym. I'm going to say, like, that's actually a fantastic idea because we've got 100 plus over females there. And every time when I look at them, I don't realize it, but, anyone could forget. And I mean, I'm always used to talking with food with them, food and lifestyle, but simple things like just a everyday, like a health checkup.
Yeah.
How often do people do that?
Yeah.
Yeah.
Not
And to
very
make
often.
it affordable as well,
Yeah.
because I also deal with women from lower ends of the spectrum, right? Lower socioeconomic status, and for them that's not a priority because we have limited resources, limited financial resources. I'm not going to spend it on doing all of this when I think I have nothing.
Question: roughly how much is a hormone test?
I'm not sure.
I'm not sure. But for mammogram, it can easily cost from 350 to 550.
So that's a private hospital, yeah.
Private
That's private hospital.
yeah.
I'm sure it costs
About
Much
100,
lesser.
much lesser at a government
public
hospital.
Yeah.
But then again, that also comes with waiting and time and making the time. But like I was telling Puveshini and Yuki earlier on when we were having a chat, make the time, people, because you want to have a good life. Make the time. Whether it's really just taking a day off to go and get a full medical checkup, if it's going to be the difference between, staying healthy and knowing you're healthy for the next 5 years and finding out that something is wrong now, make the time. Okay, I almost sound like a bit like a hypocrite lah. Now I really have to make the time also. Because I haven't.
So speaking of the cost, so I agree that actually cost could be one of the burden as well. But recently we had a discussion with certain professor, and one of the point the professor made is actually very, very interesting. So we always see a mammogram where you have to pay a few hundred as a cost. We probably shouldn't see it as a cost. See it as an investment.
Right.
It's an investment.
For
Like
yourself.
if you detect early, what you're gonna spend on yourself is a lot less than
Oh, yeah,
when you
definitely.
detect at late stage.
Very true.
Yeah.
Yeah.
And I
Very
have
true.
a funny story with that. Like, when you go for tests and the results come out negative, like you have nothing, if you're fine, then people get angry. Like, I spent all this money and there's nothing. And I'm like, but that's a good thing. That's a good thing. And that's it comes back to the investment, right? You're investing to find out that you're healthy. But if anything is not so good, you can then work on it. But it's not a bad thing if you pay all that money.
So basically, they're thinking like, oh, it's a default. I was fine to begin with.
Yeah.
Why did I even do it?
Yeah, that's why, because some of the women, when I said like, oh, I'm doing this topic, like why women are scared, then they say, oh, but don't feel sick, what? What for go for checkup if I don't feel sick? But I think they're missing the point that feeling sick, like having the flu kind of sick, where the symptoms are very obvious, is very different from other sort of illness, cervical cancer, breast cancer, where you probably, by the time you really feel sick, it's really bad.
Yes, late stages.
Whereas what we're talking about is for women to go for checkups early or on a consistent basis to avoid from getting to the stage where you feel sick.
Yeah.
For me, I would say definitely for ladies, go and get your checkup, especially, I think it's fine to do a gynae checkup every so often, like 6 months or once a year, at least once a year, so that you know everything is regular. Because I'm sure that you would also agree with me, like if anything goes wrong with your cycle, that means something is happening in your body. It could be stress, something simple as that. It could be your food, it could be your lifestyle, it could be, it doesn't need to be physical. But the minute something, I mean, our womb, ladies, okay, is amazing. Our uterus, okay, our uterus is amazing because it tells so many things about your body that you don't even know, or even like the mucus that comes out. Also very important. Actually, no, sorry. Your poop is actually very important. I'm sorry, it's early in the day, but I love talking
It's
about
okay.
this. Okay.
We are getting very real today.
No, it's true. I really because like your poop is one of the biggest things that show
Telltale
whether-
signs, right?
Yes, whether your body is functioning well. And I would say, like, ladies, if you do not go to the toilet daily,
Are you listening?
please, daily, okay? If you don't go pooping daily, all right, you better go and check, because it could be a gut health issue. It could be a liver problem. It could be something, basically it's a nutrition breakdown or something that's not going right in your body. And personally, actually, I wouldn't have known all of this stuff if not for my coach, and also if not for me actually finding out that I had PCOS, and that was actually one of the major factors that I wanted to change.
Yeah,
my
but I would
lifestyle.
like women not to get to the point where you actually suffer from something
Yeah.
to find out more. So, I really hope, like a session like today just opens your, opens your mind and heart, because, you have to have a strong heart, because the what ifs without the strong heart to get you through the door, to just go for a checkup. And if because we don't want you to go for a checkup and find out things and learn about things only when you are like you are sick.
You can also say this: your body is a car. How often do you go and service your car?
Okay, that's also very bad for women. Women very bad with servicing cars.
Okay, that's true actually. That's why I've got parents. I've got parents that help me. To remind me. But my point is, like, if for anyone to look at it, okay, maybe not a car lah.
Like a machine.
What's
Like you need
good,
oil
like
in a machine.
what's good for us females that usually we will go and definitely service.
Hair.
We spend a lot of time on facial, on
Yeah.
hair, medi-pedi.
But you see, we do spend. But that's the thing,
Yeah.
That's the thing. We will spend time going to get the hair done,
Yeah.
going for facial,
Yes.
and spend money. These things all cost money.
Money, yeah.
But why, when it comes to the most core important thing,
We have no time.
we suddenly have no time?
I think also, once again, it
What,
boils
somebody laughing
down-
back there?
I think it boils down to where we have been programmed to be. Us ladies,
Everyone-
we
yeah.
like anything that's pretty, visually nice, and of course, the first thing that you will look at is yourself in the mirror. So I think that's one of the reasons that you go like, okay, we want to fix this first because this is happening. But we forget that it's actually internally you fix it, then externally you're gonna look good. For example, skin. Skin, when you have acne, it's usually a telltale signs, once again, of what you're putting into your body, simply put. And also, are you getting enough rest? Are you drinking enough water?
Yeah.
And
Are you stressed enough?
Yes.
Or not?
Yeah.
How's your stress level? I think stress
Exactly.
level, so people forget that, stress leads to other
A
sort
lot
of
of
Exactly.
ailments, physical ailments as well.
physical
Yeah.
ailments.
So you can already tell, like, physically, those are the external things that could happen, but they forget if you fix all that, then outside is going to look fine. Yeah.
So I think maybe we need to start, creating the awareness that for every haircut or for every massage or facial, put aside for one checkup.
Yeah.
Yeah.
Because ladies, no matter how good you look, how fit you feel sometimes, if you don't go for a medical checkup to confirm that everything, because sometimes betul ke when like breast cancer and cervical cancer, you don't really show a lot of pain signs until when it's really
when it's too late.
When it's too
Unless
late, right?
you do a regular checkup, like when you're showering,
Yeah.
try to touch your breast. But one of the talk that I was given is unless you know what to look for, or else it can be difficult.
Right.
When you go through it, you actually feel a lot of different sort of lumps, and some of them could be just benign, some of them could be something serious. But how many women actually touch their own breasts? That's the question to
They
start
feel
with.
embarrassed to
yeah,
even touch
to
themselves.
do it. Yeah, how many women should
and
start to
that's-
check?
yeah.
Do a self-check. Such simple thing
Right.
as self-checking. How many women actually doing it? Yeah.
yeah.
It's cool. This reminds me of that TV show Sex in the City.
Yes.
Yeah.
You know that episode of where she had to look down at her vajayjay
Yeah.
for painting? I'm gonna ask, how many ladies, actually look down at your friend? At your sister, your one and only sister.
Okay, Chop. Why is it so hard for us to even call it what it is?
The vagina.
Yeah.
The vagina.
Yeah.
Right? It's like called flower lah.
Petal lah.
What lah? So, it's like why?
I think it's
mean,
just to make it
scientifically it has a name.
Yeah.
You know?
I encourage, I think I spoke to you before,
Yes,
I encourage
yes.
parents to even name your body part, name your children's body parts to them.
Exactly.
Even
Yes.
the vagina,
Exactly.
even the
Yes.
penis. You tell them this is what it's called. So if someone is calling it a flower, you need to be very careful about that person.
Yeah.
Why is that person calling a vagina a flower? That is
Why is that? Now I wanna
because, okay, when you talk about sexual harassment with
Yes.
kids, right?
Oh.
Yeah.
So usually people, the harasser or the molester would not call it, oh, I want to touch your vagina. They would use like pet names because they don't want the child to go around talking about it.
Yeah.
So if you are teaching your child how to name their body parts, then and your child suddenly calls it a flower or a petal or whatever,
Yeah.
then you know that something's up. Who's calling it that?
And someone else told me, I know this is a bit lari topic, mothers and women, but someone also told me that it's important because when making a police report,
It's very important.
it's very important.
Yeah, because it's very
because
clear.
if someone says, but if someone like a child says like, oh, someone touched my birdie. Birdie can be what?
Yeah.
Birdie can be the toy. Birdie can be
Could be the real bird.
the real bird. You
Yeah.
know. So teaching kids to say it as it is. So when you do get faced with having to make a police report, it is clear that someone touched my penis or
Yeah.
someone touched my vagina.
So once again, I think it comes down to how we've been programmed
Yes.
since young to not talk about taboo things.
Yes.
So I think spreading the awareness of opening up, it's fine to talk about
Yeah.
stuff like that. There's nothing wrong, like when the minute you say vagina,
Yeah.
Yes.
the penis.
Yeah.
Yeah.
And also like for younger women, right? Because we live in a society where it's taboo to have like premarital sex, or it's still considered like that. So when you are sexually active before marriage, then there are certain tests that you need to do, like sexual tests.
Yeah.
And when I used to intern, when I was still interning, I got in touch with Pink Triangle. They work a lot with sex workers. They work a lot with people like to stop HIV and STDs, right? And they also there was some research that actually shows housewives have a higher tendency of contracting STDs
Yes.
compared to sex workers.
How is that?
Because sex workers sometimes they actually have a lot of more knowledge and awareness that this happens, so you have to use condoms.
Right.
You have to check.
Okay.
Whereas people who are in relationships and they are sexually active,
Yeah.
they might not be
Is
using
it
it.
housewives? And it's
Housewives or with their husbands.
Yeah.
You don't know where your husband has been. I mean, I'm not. Of course, you need to have
But
trust
it's
and all
true.
that. But
It's true. It's true. There are statistics that says like up north, especially Kelantan, Kedah, where a lot of housewives are the ones contracting HIV because of their spouse going outside.
You don't know where they have been.
Yeah.
Then they come back,
And
you
because
think,
you're the wife,
Yeah.
you're not going to think to have to make your husband wear a condom, right?
Yeah.
So, yes.
and if
Yes,
that's the
welcome
case
to
with-
real world sometimes, you
If
know?
that's the case with housewives, what more if you're not married and you're sexually active?
Yeah.
There's
Yeah.
a higher risk. But
Yeah.
you don't think of that. You think because I'm monogamous, my partner, you expect
Must
your partner
be.
to be.
Should be.
But you don't know.
And this day of age, where
Yes.
everything is just open and free.
Yeah.
So that's using condom, ensuring that your partner uses condom. that's also part of preventive healthcare, right? Because if you're not going to do it and you're not going to insist that your partner uses it, then you stand at a risk as well.
Yeah. Doesn't help with the pill anyway.
Yeah, the pill just stops you from getting pregnant, but it doesn't stop all STDs.
Yeah.
Oh, and talking also about the pill, the girls when they're on the pill, they don't know what happens.
Oh yeah, because they don't understand. I think that's the thing. I mean, even when you do go for a checkup, I think people forget to ask questions.
Yeah.
You just expect like, okay, doctor, check up. You know, you're not going to be asking the doctor what you really need to know. You know, like unless the doctor comes back and say, okay, this is your results. You have this, then you get into the okay. What do I know? Whereas I think that every time you go for a checkup, you have access to an expert.
Prepare some questions to
Prepare
ask.
some questions. Listen to Dr. Yukin. Okay?
And
Just prepare some
I don't
questions.
know if you would agree. Like I was reading an article about this, and they said that how often do women go when the doctor prescribes something to you? How often do you ask, has this medicine been tested on female subjects? You know, has there been proof that it works on women?
I don't ask that. I usually ask what the side effects.
Yeah. Because a lot of medical research, correct me if I'm wrong, it's done
based
on
on
men. And so how is this medicine
How does it affect us
us?
as a woman, right?
Yeah.
Because that's true. That's one thing I learned as well when I went to the L'Oreal Women in Science conference. The fact that they're pushing for more women scientists to come up is the need for more research that are based on women, because a lot of medical research out there is based on testing it on men. So your treatment will be based on like how men would react to it. So that was the thing that really opened my eyes as well when I went, and I was like, yeah, we need more women scientists out there.
Yeah.
And you also need more women to volunteer as subjects
Yes.
for trials.
Yeah.
So that you have more solid
But
data.
I think women first go for checkups.
yeah.
No need to be test subject yet. Just go for checkups first, because the data is still collected in so many ways. Am I right? No? Yes? Or it still need to be like a test subject?
Participants in our study are actually all volunteer. So I think these women are amazing, like especially those breast cancer, women diagnosed with breast cancer and said yes to research. They probably know that it's too late for them. Anything that we can find is probably too late for them. But because of their contribution, they're going to make a difference to the
For
future.
the future women.
Yeah.
How does one become a volunteer for stuff like that?
For example, if women diagnosed with cancer in certain hospital, for our study, we actually recruit from Sime Darby Hospital, Semang Jaya Medical Center, and also from University UMMC. So we will ask the women whether you would like to participate in research or not. So it's their choice. But I would just say that the women in our study, they are amazing. Yeah.
Okay. I have been told that I have 5 minutes left. I just want to see. Okay, we've talked quite a bit on the physical aspect of going for checkups, physically. I really am wondering the mental issue. I mean, we talk about, why when it comes to women, everything is so taboo like that. Talk about, sexual health also taboo. Talk about mental health also taboo. I don't know, people really expect women to be made like superhumans, is it? Fact is, how many of your patients or clients that come in because they want to have a healthy mental health, or they all come in when they're all like in pieces already, or how does that work? I'm sorry, I mean, I know it's not meant to be, no, but it's true.
Yeah.
I mean, I've had breakdowns as well, it's not cheap wanting to see a psychologist or a psychiatrist. Yes, we have government hospitals that have good doctors as well, but sometimes, women shy, right? And so to be seen with a crowd of other people, even though they don't know each other, you might still think like, oh my god, what's that person thinking about me sitting here going to see? So for example, for you, when women come to you, are they really having a nervous breakdown, or they are already having a big issue?
I think it really depends on what's your awareness level.
It's awareness, right?
comes down to awareness, because people who are aware, then they know that, okay, I need to do all of this to keep myself healthy. I need to, because sometimes I also tell them I also focus on holistic well-being. So I tell them to exercise, you eat well, you drink well, you get enough sleep. Because if all that is not going on well, obviously you're going to be stressed, you're going to be anxious. And you also need to look at your environment. What kind of environment are you putting yourself in, and do you want to be in this environment? So people who are aware would come in when they notice that, okay, I'm starting to feel very anxious recently. I'm starting to snap very easily, so there must be something off. So let's go and talk about it so that I can stop it, nip it at the bud. But a lot of people would be like, never mind, this is normal. I mean, family means like this lah, life means like this lah. You have to be stressed, stress is normal. So you always normalize.
Know many people like that.
You normalize this, and then it gets to a point where you cannot cope anymore, you cannot function, and that's when you come in and say, I really need to talk to someone. So that is very, very unhealthy. So the moment you start realizing that you are snapping very easily, you're getting very anxious, you're feeling down, you're crying, very weepy most of the time, then there's already telltale signs that something is off.
Okay.
And you need to either have that self-awareness to take a pause and check what's going on. What is it that's causing me to be this way? Or go and speak to someone.
So, say if a woman comes in, and she really doesn't feel anything, but she just wants to have a chat with you or something like that, that's still fine, right?
Yeah, that's
It's
fine.
not like you're going to
Say, no, I can't see you.
I can't see you because you don't have a problem.
Yeah.
So, is that something encouraged for women to do once in a while, like how we would encourage women to go for medical checkup, right? Like every year go for medical checkup. Do you think we should encourage women to go for like a mental health checkup once in a while?
Yeah.
Even though you don't
Just
feel
drop
like,
in.
know.
Yeah, you can, but let's be real, because it's expensive.
Yes,
You
yes.
pay per
Yeah.
hour, per 60
Yeah.
minutes. Okay, so if that is not something that you can do or you don't want to do, that's fine. But just read up more on how do I take care of my emotional health. How do I improve communication with one another? Because sometimes in families, right, when you have conflicts, you have conflicts with between husband and wife, or with your children, with your in-laws, with your parents, right? We normalize that. We think it's okay. It's family, it's like this, and we don't do anything about it. But that is something that you can work on. You can come in as a family to discuss why is it that we're always arguing and at each other's throats all the time. So that is taking steps to prevent yourself from being continuously harassed, or continuously in that vicious cycle. So you can do things like that, or read up on what can I do. So if you don't want to read up on it, you don't want to change anything, or you don't know what to do, then you can come here.
Okay.
And you can talk.
Okay. Let's just go around and sepatah dua kata on the topic. Linora, do you want to start? And then we'll just go around.
On topic of why women don't go for a checkup.
Why women, and what do you think women should do maybe?
Okay. I will say that think first, lady, it's okay that you have one body and only one life. This is your engine. Okay, you have to take care of it as much as possible, because it's not like computer, you have reset button, you can throw away computer. This is it. You need to take care of it. So it's always good to go for a checkup, even if it's something really small. I won't say it's small, but the main thing is being aware of yourself and also your body. Are you giving yourself enough self-love? Are you giving your body enough care? And when that happens, when you actually think of wanting to take care of yourself because you gotta do stuff for other people, then maybe that's where you start going like, okay, this is what I need to do to make sure that I can attain this, or I can do this to help my family, to serve others. Then maybe that's where you see like, okay, this is important for me, and then going for a checkup is not going to be so scary, because you know how important it is for you, not just yourself, but for others, and also for the long run, it's going to save you a lot of money.
Yeah, that one I think people forget also. Puveshini?
I think you need to make sure that you are a priority. You are your own priority, and nobody is going to make you a priority if you don't do that first. So your health is a priority, and make sure you schedule in, you put it in, you plan in advance of what you have to do so that you do it when the time comes. And like Linora said, it saves a lot of money, saves you a lot of hassle, it saves your family a lot of pain.
Yeah.
Which is unnecessary if you could only prevent all of this earlier, right? So go for your medical checkups.
Okay.
Yeah.
All right. I think what I would say is the fear of unknown is normal. We all feel fear when we think about the medical checkup. But first thing to do is put it in your diary. It has to be a yearly thing or once in every 2 years. Put it in the diary as a reminder to remind yourself that it's time for medical checkup. Don't be Dr. Google.
Yes.
That's what we say. Please and please don't start at Googling about, why do I have a shoulder pain? What does that mean? Don't do that before you go and see a doctor. And the third thing I think is very important is we need to learn to love ourselves.
Yeah.
We need to learn to love ourselves. We need to know that, as a woman, we are allowed to say no. We are allowed to ask for help. We are allowed to share our responsibility with our families.
Okay.
It's your turn.
So everyone practically summarized very well for me. So I'm going to just make it short. I think, yes, everyone said it. Go for a medical checkup. Put it in your diary. Make it a girl's day out, so that everyone's there with you. You can support each other. The other thing is, women, you really do the best that you can. You won't be able to do everything. So if you can't get a medical checkup now, plan for it to happen within the next 6 months. What we're saying is that you're always going to have the fear, but you will save money if you detect anything at an early stage. You will save a lot of trauma for the family as well. Like Dr. Yuki said, bring questions along. I think when you go for a medical checkup, don't just go for the sake, like, oh, we heard on Her World we should go medical checkup, and then just go, What I'm saying is bring the list of questions. If you're paying that much money, make it worth your time. Sorry, doctors out there, but I think every patient has the right to ask as many questions they want. And if you find out that something is wrong, ask for help. There's nothing wrong asking for help. Women are not superhumans. We are human beings. We need the support. We need our own time as well. We need time to heal as well, so that we can nurture better, we can care better, and we can love better. But like everyone else said, please love yourself first. Take care of yourself. So thank you, ladies. Thank you for being here. I'm getting a bit emotional because the topic very important. Now I feel really bad that I haven't gone for a medical checkup. See, I admit I haven't gone. I will go. It's drilled in me already. Thank you so much for joining us on Hangout at Dome with Her World. Come back next month when we talk about another important topic. We are going to talk about child marriages next month. So please join us. Thank you, everyone. Thank you.
Thank you.
See you.
Topic.
Bye.